Welcome to the Ambulatory Healthcare Today podcast, hosted by NextGen Healthcare. Accelerate your success with insights from a multidisciplinary team of healthcare experts as they discuss an array of topics. These timely discussions can help you better navigate the challenges of running your ambulatory care practice. Here is your host.
Hello, everyone, and welcome to the Ambulatory Healthcare Today podcast. Our show is hosted by members of the NextGen Healthcare community. I'm Ken Kontowitz, Client Success Director here at NextGen Healthcare. Today, I get to cover a topic that is especially meaningful to me, tribal healthcare. With me, our guests Amy Church and Casey Stanger of the Confederated Tribes of the Colville Reservation. Lay out the dynamics around your local population, the community you serve, and your patient population.
Hi, Casey Stanger. I'm the Health and Human Service Director here with the Colville Confederated Tribes, and I'm also a Colville Tribal member. Our tribe is located in Eastern Washington, and we are a tribe that is made up of 4 distinct bands. And within the reservation boundaries, we have 4 different districts. And within the districts, we offer a varying degree of healthcare, from public health to direct patient care and ambulatory and clinical setting, as well as behavioral health. We also have an inpatient treatment facility. So our total population for tribal and rural tribal members is, I think right now, close to about 12,000. But half of our tribal members, or almost half, live off reservation. And of course, on the reservation, there are homes, like we have non-tribal members. And because of the way that our reservation boundary lays, we have several what we would call metropolitan areas, so small cities, and then we have very, very small towns.
Thank you. Thank you for that. So in regards to your adoption of NextGen, what factors led to your team selecting NextGen when assessing options to replace RPMS?
So there are not very many electronic health record systems that are a complete suite. As I mentioned earlier, because of the variance of services that we provide, from long-term nursing, primary care, emergency transportation, inpatient treatment, behavioral health, you can see that there's a really large variance in the need for an electronic health record complete suite. And really, there just are not very many. There were a few that were considered, but NextGen ultimately was selected because previous administrators had some experience working with NextGen, but also NextGen has really made efforts to focus on tribal health. And so I know that was one of the reasons why the tribe selected NextGen, but there are not very many electronic health record systems that could cover all of the needs that we have, or most of the needs that we have.
And I know from some of the discussions we're having right now with Amy, there's some discussion around expanding what you all are doing in the community with some other associated healthcare groups. So it was fortuitous that NextGen was selected because of our enterprise chops, our ability to add some additional practices to your environment. That's great stuff.
Specifically to the tribes too. I mean, many of the tribes are looking at bringing PRC in-house, right? So how many EHR systems are out there that have the capabilities of not only handling your documentation, your EHR side, plus practice management, plus PRC and accounting? So those pluses add up really fast.
For sure. And one other thing, and I know this doesn't impact you all as much, is around the issue of data sovereignty. At least half of our tribes are self-hosted. And obviously we give them that flexibility to manage that. If it's something that's germane and important to the tribe, rules set down by the council around data sovereignty, we as an enterprise level product have the flexibility to manage that. So that's great stuff. Now, we all know change can be hard. How did you all address the resistance to change upon adopting NextGen from RPMS? And I know you all were on RPMS for many, many years before transitioning to NextGen.
So the tribe had access to RPMS, especially on the behavioral health side. And this is, I know, true with many tribes. We have different organizations that oversee aspects of the healthcare delivery system. So, for example, we have what we call direct Indian Health Service Care clinics. So there are 2 primary care clinics on our reservation that are directly operated under the federal government, under Indian Health Service. And then we also have 2 primary care clinics that are operated independently as federally qualified healthcare center lookalikes, or what we call tribal FQHCs. So the tribal FQHCs and the Indian Health Service clinics, they operate exclusively with RPMS. But here at the tribe, where the Health and Human Service Division, even though we had access to RPMS, we never really utilized RPMS. At one point, we purchased Greenway and used that for behavioral health. And also our long-term nursing facility has its own electronic health record system. But we went really from Greenway to NextGen. Before that, it was paper.
Got it.
Yeah, but all of the other 4 primary care clinics that operate on the reservation, they are still using RPMS.
So for us in our integration, one of the biggest things I think that assisted us was just the mass support from our management, right? So they recognize the importance of allowing your already staffed super users to be active and engaged from the start of the build to the training of the end users, to really be proactive in that. We fight and hear all the time, well, that's not how we've always done it. And so we just really are encouraging best practices and workflows. And that is something NextGen nails. Every workflow in NextGen can hand it to you and say, you start here and you should end here. And when people know what's expected of them, they tend to say, hey, let's do this.
And I know that's been very fresh in your mind, given you recently had a pretty significant update, didn't you?
We did. We just upgraded to NextGen 8. So very successfully, mind you.
Glad to hear that. So my follow-up question in regards to the accounting and AR days was around a recollection I had from something you shared with me a while back, Amy, and of course you brought it up again this morning, was around the dramatic improvement in your AR days upon your adoption of NextGen. So how has that improvement on the financial side, the improvement on your AR days positively affected the financial health of your clinic?
More of a you question, but we've been able to track our AR days and go down. As far as the financial impact, I don't play much role in how the finances are played out for the tribe, so I can't really speak to that.
I think overall, from the entire process of revenue cycle, from a patient calling to schedule an appointment and coming in, having automated reminders, all of those things play a role in increasing our revenue productivity. But one of the things that I think has really helped in terms of processing, NextGen is really, really good at reporting. And Amy has been able to put together a comprehensive month-end reporting that we regularly deliver to our tribal council. But because of some of those reports, she's been able to create a true reconciliation process within our accounting division, because as I mentioned, we're not a single healthcare organization. We work for a tribe. And so our accounting department oversees anything from forestry to, all of our other divisions from education and unemployment. And so our accountants are not just working with our healthcare. So it was really important for us to have a strong reporting mechanism and in order to establish that reconciliation process. And Amy's done a great job utilizing NextGen.
What kind of insights has your team been able to glean now that you have better access to clinical and business data?
Well, we've had some pretty major success by being able to use the analytics that are offered by NextGen. So something I would throw out to everybody is we all hear every day is KPIs. What's your KPIs? What are your KPIs? So one of the big KPIs we chose to drill down on is our no-show rate. So our no-show rate was astronomical. It was in the 60%. It was very, very high. So we utilized NextGen's workflows and reports for running what those no-show looks like. What do those reports look like? And by focusing on those every month, we were able to put processes and procedures in place to actually decrease it. Now we have it, it's actually tracked for month to month. We've actually we ended up with like a 38% decrease the first 2 months of following our no-show analytics and using that for the percentage. And now we're running at about a 30%. So we had a 50% decrease in 6 months with our no-show rates.
Monumental. What an improvement.
Right? So pretty awesome.
Yeah, because no-shows are a particularly painful issue in tribal healthcare. I know with some of my tribal groups in California that I work with, it ranges anywhere from 20 to 30%. So it's a significant area of lost revenue. Which brings me to our last question. Finally, what advice would you give to other tribes looking to make the same type of transition?
Well, I know for me, I would tell them first, do it, but allow the right amount of time to truly and correctly build your program. Build it as something that you see a dream. If you think of it, build it. NextGen can help you do it, but take the time to do it right.
I think for me, sometimes it's difficult for non-healthcare, like, for example, our council that might not have experience working in healthcare, to understand the cost. And when you have an enterprise system like NextGen, it's going to cost money. So I think I would definitely mention something like that to somebody that was interested in using the system. But what I've always said about NextGen is you have incredible support system. There's not a lot of downtime in terms of upgrades and different things. And the training and the collaboration that we get, even at something like annual UGN conferences, NextGen just really surpasses my experience working with other electronic health record systems. But you get what you pay for. And so tribes need to understand that it's going to cost a little bit of money to have a good working system.
Thank you. Thank you, Casey and Amy. I appreciate that. So I believe that's going to conclude that. I did want to bring something to your attention. I've been working with Mike Harris, CIO over at Feather River, on the issues of no-shows. And in their case, Greenville Rancheria, it averages around 20%. In the case of Greenville Rancheria, that 20% equated to 12,000 patients with their all-inclusive rate of $428. That was a tad under $6 million of lost revenue. And we all know every one of those doctors, when somebody doesn't show up for the no-show, that's money lost to the tribe, right? So Mike Harris turns on Luma, and 2 months after he turns Luma on, he's on the phone with me. They're beginning to see a, what was it, 2% drop, 6% annualized, which was a $356,000 recoup of revenue that was lost. And then because they now had the ability to do patient self-scheduling, they had a 1% increase from the same period last year in patient scheduling. So it's something I'm spending a lot of time looking at and working with my clients on. So as I see, more goodness come out of some of these technology things, I'll be absolutely certain to share them with you. We'll probably see it at UGM. And one of the things that you guys are probably not aware of is August 12th, we will be doing a company tribal users group. The tribal users group is going to be taking place in Oroville, California. You do not have to fly down, but we would love to have you if you decided you wanted to come down. In addition to having attendees come in to Oroville, it's going to be at the Feather River Tribal Health Campus. It's going to be broadcast nationally. So we'll have a full agenda of practice management topics, EHR topics, and no cost to our tribal clients to attend that. So the agenda's all completed. We'll be sending that out here in the next couple of days.
That sounds amazing.
Yes.
Also, I was going to tell you, we actually go live with our patient portal, I think next week. I staggered us. I've been NextGen nutty the last 3 months. But I think we go live with our patient portal next week. And we did opt into patient self-scheduling.
Okay.
Yeah,
Well,
and just having that option for the patient portal, I think that's going to decrease our no-show cancellation rate even more.
Where we see more of an impact is with patient engagement tools like Luma. We now have clients who are actually leveraging Luma to drive their campaigns because it's so quickly for us to configure a message, send it out, and then it's all closed loop. Any of the messaging that comes back gets consumed within that message stream, and we can start working it within the EPM. When we did, I think it was like 8 years ago, I did a survey. So I sold the Gila River tribe back then. And we did a survey, and it was back then only like 20% of tribal households had a computer in the house. Most everybody, it's like, okay, how are you reaching out and touching somebody? You're checking TV times, making a reservation for a restaurant through their phone, smartphone. There's cell towers everywhere. And so that's what we discussed with them about driving campaigns from Pop Health. Don't need the home computer. You just send it as a text. Hey, Ken, you've missed your diabetic risk appointment. So not a big deal. I got it on my phone. I see the message and I can respond back to it.
Fantastic.
But I want to thank you both so much. That was a lot of fun.
Thank you for asking us.
Yeah.
Oh, and something you should tell everybody about is your I Wish tickets. I love that. I don't know what NextGen really calls them. I can't remember. But as a user, if I'm doing something and I want to try to do this, I know that if I put in tickets, that the folks that work in the background on a production will take those tickets and they could become reality. I do know that is how some of the upgrade for NextGen 8 came about, was because of users like us going, hey, could you? So that's something really cool too. I can tell you many of the other EHR systems I've worked in, they don't do that. They're just like, we'll let you know if it comes up. So that is something that, like, for me, that's a pretty big sale.
Well, I'm glad we accomplished that. That's very cool. So Amy and Casey, thank you so much for making time to join our show today. It's been such a treat. Thanks again. To learn more about how NextGen Healthcare is driving better outcomes in tribal healthcare, visit nextgen.com. If you're not already a subscriber of the Ambulatory Healthcare Today podcast, please follow along so you don't miss our next conversation. We can't wait.
Thanks for listening to the Ambulatory Healthcare Today podcast hosted by NextGen Healthcare. Never miss an episode by subscribing at nextgen.com/podcast. To see a list of products and services tailored for ambulatory care practices, visit nextgen.com.